Hi, this is Dr. Dave Peterson. Many have questions on why gluten is so problematic. Should they even be gluten-free? Why they don't feel any different when they stop eating gluten? What happens if their lab tests come back negative for gluten sensitivity, but they know they have a reaction to it? Hopefully I'll be able to answer those questions for you. Let's get started. Celiac and gluten sensitivity have become synonymous and are often used interchangeably. However, with the evolution of scientific and medical developments, this has increased our knowledge about celiac disease and gluten sensitivity. We can now ask, is it celiac or gluten sensitivity? Is there a difference? Yes, there is, and it's time to call it for what it is, especially when it comes to your health. You know, close only counts in horseshoes, hand grenades, and healthcare. In the 60s, a commission was convened in Interlaken, Switzerland, to develop criteria for the diagnosis of celiac disease. This became known as the Interlaken criteria with 3 essential elements. These are: gluten is the triggering agent. There must be a remarkable, and that means like really obvious, and easily identifiable mucosal lesion on the small intestine. And they need a biopsy to confirm it. However, since there are many other causes of these lesions, the medical community urged doctors not to diagnose celiac disease until it could be proven that gluten was indeed the cause. The Interlaken criteria was formalized in 1969 with the added essentials of a complete remission on a gluten-free diet. There needed to be a second biopsy to show that the mucosal lining had healed, and a recurrence after the reintroduction of gluten. This doesn't make sense to me. That's like burning your hand, letting it heal, and then touching the hot stove again to make sure that it was the stove that burned your hand. In 1964, anti-gliadin antibodies were detected in celiac children, caused by the ingestion of gluten. The Interlaken Commission overlooked this, and it wasn't until 1971 when anti-gliadin antibodies started to be recognized. I have to say in their defense, though, the immune system is poorly understood even today, and many continue to overlook the cytokine, chemokine, and neurotransmitters of the neuroendoimmune supersystem. Advances in science have increased the acceptance of genetic testing since about 2001. The genes HLA-DQ was identified as being a major risk factor for both gluten sensitivity and celiac disease. And by looking at the different alleles, we can determine if you are gluten sensitive or prone to celiac disease. For gluten sensitivities, the HLA-DQ alleles 1, 5, 6, 7, and 9 are associated with gluten sensitivity. The HLA-DQ alleles 2, 7, 8, and 9 are associated with celiac disease. Now there is some crossover, and HLA-DQ1 may also be associated with ataxia, or like balance and gait issues. Gluten sensitivity is not a disease. It is a state of the gastrointestinal tract health combined with the state of the immune system when exposed to gluten. If all it has done is to go on a gluten-free diet while ignoring the gastrointestinal tract health and the immune system, it can develop into something like an autoimmune gastrointestinal disease or one of the many other autoimmune conditions. Autoimmunity doesn't occur spontaneously. It requires an unbalanced neuroendoimmune supersystem with unregulated responses from cytokines, chemokines, and neurotransmitters being influenced by hormones to to set the stage. One of the autoimmune conditions is celiac disease. However, for it to be celiac disease, you must meet the interleukin criteria. Close enough doesn't count. In addition to the interleukin criteria, we can now look at the HLA-DQ genes and do antibody testing with the transglutaminase, endomycel, and gliadin antibodies. If celiac is truly just a reaction to gluten, then simply avoiding gluten should clear up all of your health concerns. You should be able to eat your way out of it. But it doesn't work that way. Why? Because of the poor health of the gastrointestinal tract and the continued provocation and stimulation of the cytokine-chemokine immune response despite following a gluten-free diet. When looked at from a fresh perspective, celiac is an autoimmune gastrointestinal disease with an immune reaction to gluten. It became apparent in recent years that the horseshoes, hand grenades, and healthcare linkage of gluten sensitivity with celiac disease only has led to more confusion. These are not one and the same conditions. You can be gluten sensitive without being celiac, but you cannot be celiac without being gluten sensitive. In recent years, it became increasingly clear that gluten sensitivity is associated with other conditions. Conditions such as dermatitis herpetiformis, also commonly called herpes, but with this one, if it's not on the genitals, it might just be a gluten rash. Hashimoto's autoimmune thyroiditis is another one, inflammatory bowel disease, rheumatoid arthritis, Sjogren's are all made worse by consuming gluten. Coincidentally, the increase in these conditions would be about the same time that the hybridized wheat and other grains were making it to the consumer. Hybridization increases both the gluten and the lectin levels in wheat. In fact, rheumatoid arthritis is directly linked to the consumption of lectins. That being said, gluten sensitivity can be primarily and at times exclusively a neurologic condition. I worked with a young 26-year-old woman suffering with balance issues and headaches who was diagnosed with MS because her MRI showed that there were 3 spots in her brain. She sought me out after being given the wheelchair speech by her neurologist. You know, the one where it was inevitable for her to end up there. Well, 6 months later, after going on a gluten-free diet and following the autoimmune protocol recommended to her, she went in for a follow-up MRI. Her symptoms, as well as the brain spots in their MRI, were gone. Her neurologist was unable to explain this because he had never seen this type of response before. It really saddens me that I see all these people out there on wheelchairs running around the grocery store in those electric carts with a basket full of bread products. Many with gluten sensitivity experience no intestinal complaints. This may explain why so many experience no changes in their digestive issues when going gluten-free. Frustrated with the lack of change, they go back to eating gluten, but the damage to the brain continues, often silently, with gradual changes in balance, memory, brain fog, fatigue. Think back to the young lady diagnosed with MS. On a gluten-free diet, antibodies over time will stop being produced after about 60 days. This does not give you a green light to go back to eating gluten, because the immune system has memory cells, and the memory cells will make it all come back very quickly. Only 1/3 of those experiencing neurologic symptoms with gluten sensitivities will suffer from gastrointestinal symptoms at the same time. While you may not be experiencing gastrointestinal problems, the brain is particularly vulnerable to immune responses from gluten. As I mentioned previously, MRIs are frequently finding brain white matter lesions due to gluten sensitivity. Unfortunately, these are often misdiagnosed as MS, and they continue to eat gluten, completing the self-fulfilling prophecy of the ever-increasing neurologic problems. So, just how did wheat become so problematic? Wheat found in bread today is a far cry from the bread of Roman times. Cereal grains are at serious risk from numerous diseases due to modern farming methods necessary for production since the 1970s. Wheat, like many other crops, have been genetically tweaked, not genetically modified, but aggressively crossbred and hybridized, and with all of that hybridization, the gluten content of some of the varieties have increased by as much as 50%. Plant diseases have been able to keep pace with the genetic tweaking and hybridization. This requires an ever-increasing genetic modification to prevent crop destruction in the field through splicing additional lectin-producing genes into the seeds. These lectin-producing genes produce metabolic toxins designed to prevent mold or other insects from eating the wheat plant or seeds, but they now become toxic to us. Grains contain lectins in addition to gluten, and although gluten in barley, rye, oats, or wheat have gotten the headlines, naturally occurring plant and seed lectins are a bigger problem. The body has two brains, the cranial brain that most of you are familiar with, and the abdominal brain. The cranial and abdominal brains are quite vulnerable to gluten, whereas gluten and the abdominal brain are particularly vulnerable to lectins. You know, there's an old adage, if the gut's on fire, the brain's on fire. However, gluten and lectins enter the body through the gut, not the brain. In this simplified version of the intestinal lining, you can see that a healthy gastrointestinal lining has multiple layers. Working with gastrointestinal issues isn't as simple as calling everything leaky gut and doing a cleanse. And this begs the question, knowing there are multiple barrier variables making up the intestinal lining, what part is leaking? Followed up by, might it require something different to correct the problem? Many plants use digestive tracts to disperse their seeds. This requires digestion-resistant lectins in seed coatings, which are able to protect the seed from digestive chemistry, microbes and bacteria, and irritate the intestinal tract to assist in moving the seed down and out of the system. The protective coating is high in fiber, which is where many health advocates recommend. This fiber is also where the highest concentrations of lectins are located. Lectin levels are higher when non-seasonal fruit and vegetables are eaten, increasing the risk of starting an inflammatory response. When lectins make contact with the intestinal lining, they irritate the lining and release metabolic toxins designed to protect the seed or plant. These pan-hemagglutinin lectins that make it into the bloodstream have the ability to adhere to many different types of tissues and all blood types. The damaged gastrointestinal lining has reduced surface areas for good bacteria to attach to. The toxins from lectins also shift the gastrointestinal environment in a bad way. I refer to this as a ghetto gut. You know, there's good people that live in a ghetto, but the environment changes their behavior in order for them to survive in the ghetto environment. The same occurs in the ghetto gut. The good bacteria alter their behavior and start producing toxins rather than nutrients. Immunoglobulins lining the gut are also reduced in number or damaged by the lectins, bacteria, parasites, or supplemental digestive enzymes. Lectins break down the barrier variables in tight junctions, maintaining the seal on the intestinal lining. Lectins can also cause a thickening of the intestinal lining, making biopsies appear normal or inconclusive. With the damage from the lectins to the gut lining, E. coli become the most prolific species of bacteria in the gut. Not only does this reduce the nutritional absorption, E. coli are prolific biofilm builders. Biofilms become multicultural communities for a multitude of different species. You may have heard of these biofilms by different names. They are referred to as polyps in the gastrointestinal tract, tartar in the mouth, and gallstones in the gallbladder. With the immune system activated due to the lectin-provoked damage, cytokine signaling stimulates the immune cells to respond. While chemokines direct the immune cells to the damaged lining, neurotransmitters are depleted from the constant distress signals being sent through the abdominal brain. And ultimately, a combined Th1, Th2, and Th17 immune response is created with a multitude of confusing symptoms. Bacterial responses might suppress the immune system as they hack into the NEI supersystem, while pan-hemagglutinin and lectins might stimulate or provoke an inflammatory response. The damaged gastrointestinal lining sheds the intestinal villi, releasing the attached digestin-resistant lectins, causing them to tumble down the digestive tract only to reattach somewhere else down the line, starting the whole process over again. Eating frequent quantities of soft lectins or hard lectins can expose the intestinal lining to toxic lectins faster than the lining can repair. As you can see, lectins cause a plethora of symptoms. Most frequently, these are associated with gluten sensitivity. Coincidentally, many of the foods containing gluten and lectins are one and the same. Did you know gluten is a lectin? Lectins occur throughout the entire wheat plant, from the roots to the seeds. Lectins protect the plant through the entire life cycle, from resting in the ground, germination, plant growth, to bolting, and then on to seed maturation. Lectins will mount a counterattack against any threat to the plant. Is wheatgrass gluten-free? This is a question I often get asked. The answer is yes. Wheatgrass is gluten-free. It is not, however, lectin-free. Lectins serve to protect the leaves from the insects that like to snack on them. While toxic to the small insect, size matters. If we were as small as a bug, wheatgrass lectins would be toxic to us too. But due to the size difference, we can make up this disparity by the quantity of wheatgrass we consume. Do you enjoy fresh tomatoes or peaches in the winter? In order for that to happen, they are picked market ripe, and this is a fancy term for they're not ready to eat yet. The fruit are still rock hard with active lectins that have not been neutralized by the plant. The fruit are picked immature and held in climate-controlled storage and transported to a store near you. In order for the fruit to arrive nice, bright, and shiny for your out-of-season consumption, it must be genetically modified to survive travel and genetically tweaked to survive insects and competition from plants in those faraway places. The farther a fruit or vegetable must travel to reach your store, the earlier it must be picked. And while it may ripen or be artificially gas ripened, the lectins have not been deactivated as done on a locally grown tree or vine ripened fruit. Lectins that make it into the bloodstream can make your red blood cells stick together. You may be familiar with the list from the Eat Right for Your Blood Type for specific blood types. However, there are over 100 fruits and vegetables that bind to all blood types not listed in the book. The damage from lectins to the intestinal lining can cause microscopic colitis. The irritation and inflammation can be bad enough to give a person distress, yet biopsies or endoscopies will not show enough damage for medical doctors to be concerned. Brown rice is recommended as a healthy alternative. So, is brown rice gluten-free? Yep, you can rest assured brown rice is not a gluten-containing food. However, remember that lectins want to prevent you from digesting them? Brown rice contains the bran, or the high in fiber, that makes it such a good alternative, but it's also high in phytates that prevent mineral absorption, trypsin inhibitor, which inhibit digestive enzymes, and hemagglutinin lectins that can bind to blood cells and all different types of tissues in your body. Because of this, white rice, which has the bran removed, is actually a better alternative. Exchanging gluten-containing grains for gluten-free grains is jumping from the pan into the fire. Gluten-free flours and grains are high in lectins, most of which are hard lectins. And hard lectins are a bigger problem than gluten because of the increased damage they do. Let me make this clear. All plants contain lectins or some other protective toxic compound to protect the plant. It does not matter if it's organic or conventionally grown. All plants contain lectins. These lectins are naturally neutralized in the mature fruit or in the young, immature vegetables. You can avoid them by eating locally grown fruit and young vegetables. Raw or uncooked fruit and vegetables can be extremely high in lectins. Now, some of the lectin levels can be diminished by heat, as in soft lectins. The cooking process diminishes soft lectins. You should avoid overconsumption of soft lectins by rotating your diet and eating seasonally available produce. Hard lectins, on the other hand, are not diminished by the cooking process. Neither is it for soaking or sprouting. They're still only reduced by about 30%, and this includes all of the legume family. Raw or uncooked levels of hard lectins are extremely high, and they should be avoided, and especially with autoimmune conditions. For more information on lectins, you can download the Autoimmune Diet Lectin Avoidance Guidelines on iBooks. What happens when lab tests for gluten sensitivity come back negative? Don't assume your immune system is working optimally, especially if you're having symptoms, even more so with autoimmune conditions. Let's take a look at two examples of compromised immune systems with severe reactions to gluten. Immunoglobulins work like a lock and key. There's a critical component to this theory. Immunoglobulins are designed to work for only one reaction. There is only one key that fits the lock perfectly. This prevents the uncontrolled immune response. In the lock and key analogy, the antigen, or gluten in this example, is the key, and the key must fit perfectly into the active site that is on the immunoglobulin, or the keyhole in the lock, SIGAs are the lock in this example. Bacteria, parasites, and supplemental digestive enzymes can cleave immunoglobulins, damaging the keyhole in the lock. And when the lock is damaged, any key, that means like any body tissue, any food that you frequently eat, can all trigger an immune response. This is a major contributor in the cross-reactive immunoglobulins. As a result of this, lab testing can be useful or misleading and confusing. Microbes not only cleave immunoglobulins as part of their survival strategy, they also have the ability to hack into the NEI supersystem, altering and confusing the immune response. Remember that microbes want to survive, so they're going to try to do everything to hide or shut off the alarms so the immune system can't see them. And this is why addressing the NEI supersystem may be the best first course of action. This is an example of a person that was hospitalized for a week after eating an almond croissant and drinking a cappuccino. You can see, despite having the severe reaction to gluten, there was no production of gliadin antibodies or fecal SIJ immunoglobulins in their stool test. Stool test anti-gliadin antibodies are able to detect sensitivity for 1 to 2 years after gluten is removed. They're also able to detect hidden sources of gluten, which adds to the confusion. Well, I'm on a gluten-free diet. Why do I have high stool antibodies? Well, it's because it's that sensitive of a test. In the digestion section of the test, the elastase levels were very low, indicating the pancreas was not releasing this enzyme. Lectins have the ability to cause a thickening of the pancreas, preventing enzymatic release. The proteins the elastase were responsible for breaking down were sitting in the colon at 98.6 degrees, putrefying, causing the putrefactive short-chain fatty acids to be elevated. Without the hospitalization after the reaction to gluten, we may never have considered that this person had a gluten sensitivity. However, in this same individual, a hormone saliva test showed a positive sensitivity to gluten. Saliva anti-gliadin antibodies are more responsive than a blood test, but less sensitive than a stool gliadin test. Saliva antibody tests become negative after 30 to 60 days on a gluten-free diet, but they must be compared to the total SIGA levels. It serves little purpose for us to run a gliadin antibody test where you're not be able to produce any SIJ immunoglobulins and then say, well, you don't have any gliadin antibodies, so you must be okay, when the fact of the matter is you can't produce them. So in this individual, we had a negative stool gliadin test and a positive saliva gliadin antibody test. This should not happen on anyone with an optimally functioning immune system. This person's immune system is definitely compromised. And the last thing you want to do in a case like this is to boost an unhealthy immune system. It may start a fire that you can't put out. This is a lab from a person that would become violently manic when exposed to gluten, which they consume multiple times a week. Their serum food allergy test showed no detectable gluten sensitivity despite their recent consumption of gluten. Serum anti-gliadin antibodies become negative after a 3 to 6 month break on a gluten-free diet. However, you'll notice just below the gluten is a high 3+ response to kidney beans, which are hard lectins. Hard lectins can provoke a direct cytokine-chemokine neurotransmitter response independently of immunoglobulins. So we have to ask why she wasn't producing immunoglobulins to gluten. Well, the answer might be they just become too fatigued to produce anymore, or possibly there were microbes involved. Now I also happen to remember that this person that went manic when exposed to gluten also had bacillus, which is an opportunistic bacteria, and H. pylori show up in their stool test. As you can see, this person's stool test also showed gliadin antibodies and SIGAs that were elevated, not enough to be out of range, but their immune system was so fatigued that they were unable to produce any higher levels. Many make the mistaken assumption that the immune system is an all-or-nothing system that cannot become fatigued. However, with repeated exposure to foods, bacteria, or other microbes, or even supplemental digestive enzymes, the immune system can indeed fatigue to the point where it is unable to respond enough to show up in a lab test. The manic behavior was part of the neurotransmitters which control the moods, working predominantly in the abdominal brain, not the cranial brain. However, the cranial brain is the prima donna getting all of the attention. The cytokine storms she experienced with the manic behavior were caused by the exposure to gluten and a rapid shift in the neurotransmitters of the NEI supersystem. Lab tests are about probabilities, not absolutes. A positive antibody test only tells us an immune reaction is likely to occur. Few recognize the reaction still must be carried out through the cytokines, chemokines, and neurotransmitters of the NEI supersystem, which are being influenced by hormones. So often I get people saying, I have positive antibodies, but I don't have any reaction. I don't know what to do. Well, that tells us that the NEI supersystem is unbalanced and the immunoglobulins are unable to provoke a response. To complement this, studies are reporting the loss of the intestinal barrier as the third element of autoimmune conditions. These studies also suggest these conditions, like gluten sensitivity or autoimmune conditions, can be changed or even reversed by reestablishing the intestinal barrier function. I welcome you to visit my website, www.stlwa.com. Please check out my blogs as well. To make an appointment, please call 530-615-4083. If you do not live close by, we can still help you remotely as well. Looking forward to hearing from you. In good health, this is Dr. Dave wishing you a good day. The information and therapies outlined in this video are not intended as a substitute for personalized medical advice. The content of this video is intended for informational purposes only. The medical information in this video is intended as general information and should not be used in any way to diagnose, treat, or cure or prevent any disease. Procedures and products described should not be considered as adjunctive to any other accepted conventional procedures deemed necessary by the attending licensed doctor.